presenting a free paper on ocular color Doppler imaging in primary open-angle glaucoma.
Just a sec. Have you put the timer on?
And systemic hypertension. Ocular blood flow may be affected in some ocular and systemic diseases such as glaucoma and systemic hypertension. Insufficient blood perfusion due to either increased IOP or increased other risk factor may cause reduction in ocular blood flow. Glaucoma is a chronic progressive optic neuropathy which leads to ganglionic cell death and progress and associated visual field loss. Usually it is associated with the raised IOP, but the other factor like vascular also implicated for the glaucomatous disc damage. Systemic hypertension is a systemic entity which usually causes blood vessel sclerosis and narrowing, which can affect the blood flow to the optic disc. There are various techniques available for the ocular blood flow assessment, in which the color Doppler imaging has particular advantages. It's non-invasive, not affected by any poor ocular media, and require no contrast. It usually uses the principle of Doppler shift in frequency to measure blood flow velocity in centimeter per second, and the parameter usually assessed by color Doppler imaging where peak systolic velocity, end diastolic velocity, and resistivity index. The purpose of our study to evaluate the effect of optic nerve head blood circulation using color Doppler imaging in primary open-angle glaucoma and systemic hypertension. This was a prospective study of 16 subjects which divided into two groups equally. Group 1 having the patient only with primary open-angle glaucoma and Group 2 having the patients only with systemic hypertension. The radiologist who performed the color Doppler imaging was blinded regarding the diagnosis. Ocular inflammation, any previous intraocular surgery, other type of glaucoma and systemic diseases were excluded. Comprehensive ophthalmic examination was performed. Glaucoma was confirmed by the clinical examination and imaging techniques. Systemic hypertension was confirmed by the physician reference and opinion. We performed the color Doppler imaging and the parameter measured were peak systolic velocity, end diastolic velocity, and resistivity index in ophthalmic artery, central retinal artery, and short posterior ciliary artery. These are the three signature graphs for the ophthalmic artery, central retinal artery, and short posterior ciliary artery in color Doppler imaging, which shows the specific graph for all three different arteries. This study consisted of 16 subjects, 8 in each groups. 13 were male and 3 were females. The mean age for Group 1 was 65 years and Group 2 was 59.75 years. This table and graph showing the parameters in ophthalmic artery, which shows there is decreased peak systolic velocity and end diastolic velocity and increased resistivity index in glaucoma patient compared to the hypertensive patient, but a significant reduction found in peak systolic velocity only. This graph and table shows the parameter in central retinal artery, which again show the decreased peak systolic velocity, end diastolic velocity, and increased resistivity index in glaucoma patient compared to the hypertensive patient, but the significant reduction found in peak systolic velocity and end diastolic velocity of glaucoma patients. This table and graph showing the parameter in short posterior ciliary artery, which again shows the decreased peak systolic velocity, end diastolic velocity, and increased resistivity index in glaucoma patient compared to the hypertensive patient, but the significant reduction only found in end diastolic velocity. So we compare the two groups with the Mann-Whitney non-parametric test, and the significant p-value were found in peak systolic velocity of ophthalmic artery, peak systolic and end diastolic velocity of central retinal artery, and end diastolic velocity of short posterior ciliary artery. We conducted this study with the hypothesis that the atherosclerosis in systemic hypertension could cause a narrowing of vessels, which can decrease the blood flow to the optic nerve head, which could be a risk factor for primary open-angle glaucoma. Vascular etiology in glaucoma in spite of normal IOP has been implicated for the glaucomatous damage, and the significantly slower mean blood flow velocities were found in our study, and the similar findings were reported in the study by Rojan Pongman et al. And Mughbal et al. Also. But we could not find any significant association between systemic hypertension and altered blood flow, and there were no other literature found this association. So our study supported the vascular theory for primary open-angle glaucoma, but we did not find any effect of systemic hypertension on optic nerve blood flow. Although our sample size was very small, but what could we find? The color Doppler imaging shows the significant optic nerve head perfusion abnormality in primary open-angle glaucoma, which strongly suggests the vascular theory, but the systemic hypertension cohort did not show any significant effect on ocular blood flow. These are the references. Thank you.